I'm Joe Chile, mornings from 7 to 9 on Buffalo's oldie station, the Big Wack. Joining us on the Big Wack's Buffalo on the Rise today is Dr. Ronald Gefaller from SoftWave Buffalo. How you doing?
Very good, thank you. Thank you for inviting me.
Oh, glad to have you here. Tell us about SoftWave therapy. This is really kind of a mystic thing to me, but I've heard of it before, but I'm not really sure what it is. So...
SoftWave therapy is something that's old and new. It's been around for over 25 years. So it's using technology that was originally designed for working on kidney stones, but they're using it for all sorts of new things now. It's using sound waves to go ahead and create physical changes inside the body. You're actually using sound waves to create changes as far as the body's ability to heal. You're increasing circulation into the body. You're reducing and modulating inflammation, so you can go ahead and reduce down pain for acute conditions and for chronic conditions.
Now, when you start talking about sound waves, do they kind of vibrate in the body?
Actually, what the sound wave actually is doing is it's compressing and expanding out the cells. So you're actually squeezing the cells a little bit, and you're mimicking a new injury to make your body think that you're getting injured when you're actually creating no damage at all to the body. You're tricking the body into having a stronger response, stronger healing response.
So what kind of conditions and injuries are we using this for?
All sorts of different things. In my end of things, I'm working with orthopedic injuries, so it's knee problems, shoulder problems, hands, wrists, ankles, arthritis, things like plantar fasciitis, tendinitis, bursitis, all those chronic aches and pains that we have that just don't want to go ahead and get better.
What about things like wounds, burns, things like that?
It's being used tremendously to reduce down and the inflammation associated with new injuries, and actually it does tissue regeneration. It forces your body to make new tissue. It's not just healing it up with a scar, you're actually forming new tissue all over again. You can actually replace what's been damaged and lost. Not only just for wounds like that, for soft tissues, but also for the nerves too. It's patented and FDA approved for soft tissue regeneration and for nerve cell regeneration.
This is kind of amazing to me. Now, what makes it more effective than like a shock wave type therapy?
The shock wave therapy is it's an older technology than what we have now. Okay, shock wave therapy is designed to go ahead and create some tissue damage to stimulate your body to start healing up again. Okay, you heard it to make it get better again. What this is doing, it's basically stimulating your body to have just a positive reaction as opposed to damaging it and then trying to heal up. You're actually tricking the body into thinking that there's an injury when there isn't, and you force a stronger healing response.
Okay, the elephant in the room. Mm-hmm. Does it hurt?
It doesn't hurt on normal tissue. We're using a little bit of soreness to go ahead and actually find out where the injury is. It's a very diagnostic type of therapy where I can actually find out specifically where the damage is and where it's not. So I can treat the damage more effectively and quickly it actually reacts to the damaged tissue and creates a little bit of soreness, okay? Not bad, we can go ahead and control that.
How long does it take, for this to happen? Does it happen immediately? How many sessions would you have to go through?
Most of our patients, about 90% of our patients, show a significant improvement with the first visit, okay? That we actually can get a change in pain and a change in flexibility after the first visit. And the visits, it takes maybe about 15 minutes of treatment to go ahead and create those kind of changes. And those changes, after the first visit will last for anywhere between a few hours and a few days. But it's an accumulative type process, like working out and dieting and things like that. It's basically after about, anywhere between, 1 and, 12 visits, we can go ahead and get the condition more under control and have a really strong response. We have about a 91% response rate.
Wow.
As far as getting people to go ahead and get back to a normal activity.
Is it covered by insurance, Medicaid, Medicare?
Unfortunately, not right now. Okay, any stem cell type of treatment that this is considered is not covered by insurance right now, but we try to keep the costs very, very competitive and easy to go ahead and live with. We have actually a low-fee diagnostic, initial visit just to see whether we can help. And if we can, that's great. We'll go ahead and move from there. If not, then this isn't the right thing for you.
I don't want to put you on the spot here,
Sure.
but is it safe?
Extremely safe. It actually creates no damage on your body. You can use it on almost every part of your body. It's safest thing you can go ahead and do as far as any type of therapy I've ever seen. The worst you're ever going to get out of it, I mean, the FDA says the side effects are negligible. You're getting maybe a little tenderness and maybe a little bit of redness in the tissue temporarily, and that's it.
So that's it for side effects.
That's it for side effects.
Because, you know, when we talk medication now, there's a whole list of things, disclaimers for everything going on. All right, so who would be a candidate?
Well, as far as what I'm dealing with, anybody that's got a, acute condition that's not improving as quick as they want to, if they want to speed up the healing rate to go ahead and get back to their activities better and faster, their sports or whatever, and people with chronic pain conditions that just aren't getting better, people with arthritic conditions. I see a lot of people with bone-on-bone knees, bone-on-bone hips, people post-surgery that they're not healing up well enough or quick enough, they don't want to get back to their normal activities faster. It's basically anybody who's got, chronic or acute joint pain, muscle pain, tendon pain, bursitis, tendinitis, things like that, is what I deal with.
We only have a minute left, but I want to mention the fact that you said certain NFL teams are using this.
Yeah, a lot of NFL teams, Major League Baseball teams, NBA teams, a lot of hospitals like Mayo Clinic is using it, Cleveland Clinic is using it. It's very well received by a lot of different professional organizations.
Dr. Gefaller, it sounds fantastic. Thank you for joining us. I really appreciate it. For more information and answers to your questions, contact SoftWave Buffalo by calling 716-667-6800 or go to softwavebuffalo.com. Sponsorship and promotional consideration for the preceding segment was provided by SoftWave Buffalo. And don't forget to join me weekday mornings, 7 to 9 on The Big Weck.